Good evening, everyone. I hope you are well. I hope you can hear me for a start. Thank you for joining me this evening. Sorry, I was just a few minutes late, but it's rude of me to come in before the song has finished. So thank you for joining me this evening. I hope you've got a cup of tea, a glass of wine, whatever it is that floats your boat this evening, and some water, whatever it is. I've got my water just in case I need it today. So there we are. So thank you for joining me this evening. We are here to talk this evening about tooth whitening. It's quite a controversial subject in the beauty industry. So it's one that I am very, very passionate about covering in a very amenable and approachable way. And that's why we're here this evening. So there's no judgment. If this is something that you're already doing in your salon, hopefully you're going to take some messages away from this webinar today. So I am here on behalf of Shop Beautiful. I am a trainer for Shop Beautiful and MedFX. I'm also a trainer myself as well. That's something that I do and that I love to do. So I'm passionate about kind of teaching people the ins and outs of things for them to make their own decision about what's right and what's wrong. And that's what today's about more than anything. So please do tag me, us in your attendance this evening. Tell us what you thought to the talk and any other topics that you would like to see, because we're always keen and interested in learning from you guys, the sort of things that you're after looking for as well. You have to excuse me, I'm a bit out of breath. I'm just back from a walk with the dogs. So I have had a little bit of time out just before I sit on the screen for the next hour. So we are going to be here for about an hour. If you have any questions and answers, pop them into the Q&A section. You should see that on the bottom bar or the top bar, depends on where you're looking right now. If you want to chat amongst yourselves, you can do that in the chat. But obviously I'll fail to monitor that as I'm going along because I'll lose my trail of thought. But questions and answers, pop them in the Q&A section and I'll do my best to answer them as best I can towards the end, if not halfway through as we're going along. So yeah, thank you for joining me this evening, and let's continue. So if you want to pop in the chat why you're here and where you're from and what you're about, that's also great as well. So what's this evening about? This evening, I've got some new glasses on as well, so if I keep adjusting them, then you know why. I'm just kind of finding my feet with them, as you do. It's like, oh, yeah, that's about right there. So we're going to be discovering what tooth whitening is. You probably already know this. You might have had the treatment yourself. We're going to learn of safe ways to whiten the teeth, and that's an important one. We're going to identify if salon whitening is actually legal. We're going to discover who the GDC and the CQC are. We are going to implement a business plan idea to help you and your clients that are looking for this solution as well. Okay, we're going to recognize your remit. We're going to learn when to say no thank you for these business in a box type setups. Sorry for the typos on here. This is something I was just putting together this afternoon and I can see those. It's quite embarrassing. Discover top tips for smile health as well. So that's what we're going to get out of today. It's not a lecture. It's not me telling you what we should and shouldn't do. It's me giving you that information for you to make an informed decision, because that's what's important as adults and as professionals as well. Okay, so that's what we're going to be covering over the next hour. Okay, so who am I? Who's this bird that's talking to me? I am from the East Midlands, as you can probably tell, some of you, and you're listening to me talk. My name is Annette Matthews. I am a dental professional, so I'm a dental hygienist and a dental therapist. And yes, I do wear a Coca-Cola t-shirt every now and again because I'm also a real human being. I thought that when I put it on today. But yes, I am a dental hygienist, a dental therapist. I also have my own skin and aesthetic centre in the East Midlands in Wirksworth, Derbyshire, called W Skin. So before I went on to dentistry, before I was a dental nurse and then a practice manager and then went on to university to be a dental hygienist and therapist, I actually worked in the beauty industry. So my dad was very, very good to me, and he kind of put a deposit down on my own salon. I was kind of 16, 17, 18 at the time, not ready for that sort of thing. And the beauty industry has changed massively since then. So that's where I started. Then I've kind of moved around and obviously gone down the dental route. And then now my passion lies with a combination of the two, really. So I get it. If you have your salon, you've got clients that are looking for these sort of treatments. And that's where the misdemeanors and the complications and the confusion behind it all comes in, because it's something aesthetic, something cosmetic. So hopefully I'm going to shed a little bit of light on that for you this evening as well. Okay, so do check out W Skin if you get a moment. So it's a really exciting time for us. We've got our business bounce back. So yes, I've had to close as well. over the last goodness knows how long. I've lost count, fed up of being at home. But yes, April the 12th is a date that we are due to be back. So you're probably getting bombarded in your inbox with messages for these amazing packages to buy, and buy this and do this and offer this to your clients and do this and do that. I'm getting it too. It's quite stressful. You're a bit like a headless chicken right now. What do I need to do? Well, hopefully by the end of this, it'll help you make an informed decision about something that might hit your inbox in the next few days as well, because I've had a few of these already today, and over the last couple of days. So we want to spend our money on things that we can actually utilize and use and do well. Okay, so that's what I'm here for. I don't want you to waste your money on things that can't work out, and here's the reason why. Okay, so April 12th, there's going to be a little bit of negative Nelly coming. I'm not going to kind of lie about this. As a dental professional, there is going to be some negative Nelly for those of you who are working in the beauty profession, but you're going to take something away from this, which is business acumen and how you can flip this on its head. So please do stay tuned. I am approachable, I am amenable. You can chat to me, you can tell me your thoughts and things if you want to at the end, and I would more than happily connect with you and kind of expand on it further if you need me to. But let's look forward. April the 12th, very exciting that we can get back to work. This is something, I just Googled it today. This isn't a brand. This is just an image that I found for tooth whitening. We know what tooth whitening is. It is classed as a cosmetic procedure. It is where we change the color of the teeth. Simple, right? It's not that difficult. It's pretty much like brushing your teeth, isn't it? There is a lot of misconception around tooth whitening and the ins and outs of it. So that's what we're going to cover really over the next hour, amongst other things as well. If you Google teeth whitening, if you hashtag teeth whitening on any social media platform, you will see an absolute abundance of tooth whitening options available to the consumer. Okay, and us. So to the consumer and to somebody who supplies to a consumer, someone who supplies any sort of service. Okay, so this is where I want us to be thinking about this. This is what the consumer is going to see. This is the sort of thing that they're going to want. This is what they're going to come to you for, potentially, because you're working in an industry of beautification. You're working in an industry where you can offer to make someone feel better and look better about themselves. So you're probably going to get people asking these questions. In my dental setting, I get it every day, or the days that I'm there. In my aesthetic setting, I get it probably more so. So I understand that you guys are going to get these questions. What I want you to be doing throughout the whole of this is thinking big. So yes, Annette's going to come out with some negative Nelly stuff, depending on what situation you're in. It might be something you already offer. It's going to leave you feeling a little bit not good about it. Okay. But I want you to think big and how you're going to flip this on his head and how you can change this to make the right decisions for your clients. I want you to remember, I am here, and I am here on behalf of Shop Beautiful and myself and the dental professional and the beauty profession and the aesthetic profession, because I think what you do is absolutely incredible. I've mentioned my journey and where I started. Now, when I did beauty therapy, if it's anything like it is now, I wouldn't have probably felt I needed to go on to dentistry and aesthetics and things like that hand on heart, because there's so much that you guys can do and the skills that you can develop in these extra qualifications that you can do. So I do think that you guys absolutely rock, and there's so much that you can do, and there's so much more that you know about things that I would quite happily refer on to you. And that's why my clinic, my wellness center, my clinic that I have, I've put an image of it there, but there isn't. I've taken that slide out. We have multifactorial people working there. So we've got people from all different backgrounds that offer lots and lots of different procedures and treatments, because that's important to me. Skill mix integration and people that can do different and variant roles. Okay, so please remember this as we're going on. So what is tooth whitening? It's pretty easy, right? We are basically removing the muck and the grime off the teeth, and we are making them whiter and brighter. A bit like what we do when brushing our teeth, but we're just applying something, we're painting something on the tooth, they're chemical, that obviously somebody's trained us to use, so it's safe to do, right? And we are whitening the teeth. Unfortunately, it isn't that simple. And I'm here to kind of just get you thinking a little bit about that. You will see there are multiple training options out there, And this is where I want to kind of hit you with the black and white. And hopefully that's why you've joined me this evening, because people who have messaged me about this webinar today are from different professions. So we've got the dental professionals that have messaged me, I've got the beauty professionals that have messaged me, and the aesthetic professionals that have messaged me. And then what about this and what about that? By the end of this, hopefully I'll have answered all of those questions. But if you do have anything specific, then do let me know. But it's not quite as simple as it looks and now as it's made out. So again, I'm just going to waffle a little bit about me. So in 2000 and I have to think about this, 13, I graduated from the University of Sheffield. I started around about 2010, so it's a 3-year course. Yes, she's having to think about this evening, you see. So 2010, my daughter was 1 year old and I went to university like an absolute madhead. I went to university because I had done dental nursing for a little while, kind of looked at what the hygienist and therapist did and the dentist did, and I thought, I can do that. I could do that. Get me there. Let me try and do this. It's not that easy when we get into it. Those of you, you know, when you go to the dentist, and it's a very intricate area that we're working in as well. So my point is, it's a degree level training. We are sat, these phantom hairs, quite scary looking things. This is what we train on, and we train in multiple procedures in order to look after the skin of the mouth, the mucosa in the mouth, the gums in the mouth, the teeth in the mouth, and all the surrounding tissues, the head, the neck, and all these areas as well. So it's very, very full on and very, very intense. And get your violins out. As a single mum at the time, it was a very, very stressful experience for me, but not one that I would ever change. I love the fact that that is my background. Why I wanted to put this slide in is not to show off, is not to say, well, I've been to university and this is why I can do this procedure and you can't. That's not what this is about. This is about the background that goes into the learning as to why we can offer something and we, you know, why we're doing what we're doing ultimately as well. Okay. And as you can see, very proud moment for me. But one thing that really bugs me, this sounds really vain, but the colour of my nails that I chose on that day, absolute nonsense. Neon green almost, does not match anything that's going on there. Okay, so when we're thinking about teeth, what are we thinking about? It's a simple procedure of kind of cleaning the teeth, making them look whiter, right? As I've mentioned, we learn in the lab that this is just a nugget of things. And I know there may be some dental professionals that have tuned onto this to kind of see what's going on as well, and why next, you know, talking about this evening. This is just a snapshot. So you've got gingivitis, disease of the periodontum. That is the bit that the teeth is attached to. So the bone that holds the tooth in place. We've got recession that we need to think about. We've got exposed nerves. We've got cavities and decay of the teeth. Okay, so all these things that we need to recognize and understand and ensure that before we're doing any sort of tooth whitening, any sort of application of any product, even I can't get my words out this, hydrogen peroxide products or carbamide peroxide products can still have an effect. It's a chemical that's going onto the tooth or the surface of the tooth and the gum area. Okay, bear with me. There we go. The fact of the matter is, dental problems and problems that we might not be able to see, that our trained eyes are not trained to see, can cause irreversible harm when we do any form of tooth whitening on them. That's a fact. You may have cracked teeth, there may be chipped teeth, there may be stained teeth, there may be something called fluorosis. We should be and need to be looking for the likes of oral cancers. You've got poor gum health and hygiene. The fact of the matter, you've got viral infections and conditions that we need to pick up. And I know some of you guys are probably already kind of key up with that, because there's certain procedures that you can't do with the likes of herpes simplex and cold sores in place. And that is not me being undermining in any way towards you at all. Poor cross infection and sterilization, you'll see on my next slide what I mean by that. And then we've got appliances that are put in the mouth that weren't there before. So we've got the likes of crowns, bridges, implants, and veneers that we need to consider when we're doing these sort of treatments. Okay. If we upset the gum around in a certain area for whatever reason, you might have it where you've used an electric toothbrush too much in one area, we get something called recession. And that recession can happen with these sort of procedures as well. And it's irreversible. There's nothing we can do about it once it happens. This is a picture and image. Again, I just got it off Google Images today. This is a dental decon setting. So this is a setting for the instruments used in a dental setting. We usually have a decon nurse now, and obviously things have changed a little bit with COVID, but we have a nurse that is there to completely, obviously, gut the instruments and everything that we have used on these clients and individuals. And I understand that certain companies may offer disposable options that make it easier for you guys in order to do these procedures. But this is my point in terms of the cross infection and obviously where we're going to be doing these procedures as well. There is a video. I'm going to put the link in the chat towards the end. But if this was shared with me by a colleague this morning, I was really glad that she did actually. And it's a BBC documentary that was made about tooth whitening. So it's definitely worth a watch for you guys as well that have tuned in for this. So I will put the link in for you to have a little look, because it is worth a watch. It'll kind of tick all the boxes again, and it'll get you thinking, right, okay. CPR and medical emergency management. This is not me being condescending in any way, but we as dental professionals have to have regular CPD, like you do in the industry that you're in as well, to keep up to date with things that could commonly and do commonly happen, unfortunately, in a dental setting, because we are applying things on, in and around soft tissue and in areas of the mouth where it can impact that patient as well. Okay, so these are the sort of things I just want you to have at the back of your mind. Now, I'm not going to play this because it is quite long. It's around about 8 minutes long, but this is the video that I'm talking about. So here's the link to it, which again, I'll put on the chat. So it's basically a documentary that was filmed to talk to you about the options of tooth whitening and the legalities behind it as well, which is pretty much what I'm doing this evening, but it's a video that talks you through that as well. And there's some of my colleagues on there. And as I say, my lovely colleague Melanie shared this with me this morning. So this is it was a secret recording of some training that offered to get you as a tooth whitening technician in a day, or an online training tooth whitening technician in 24 hours, whatever it is, with a starter kit for £1,500, £2,000, whatever. Okay, so do have a look at this. It's definitely worthwhile watching. Again, I'll pop the link at the end. Again, you know, another thing for me to mention is when I went to university, I couldn't treat clients for the first 6 months because we're obviously training anyway, but my vaccinations were all out of date. So my parents, being my parents, just didn't care about me and decided not to send me for some vaccinations. But that meant that I wasn't able to treat clients for a little while. I had to have certain vaccinations in order to do that as well, such as hepatitis B and things like that. So we are dealing with the saliva, and obviously we are all too more aware now of viral things that are going on around us. So that's another consideration of safety for you guys if you're putting yourself in harm's way with these treatments, regardless and irrelevant of PPE. So I'm hopefully now getting you to get the juices flowing a little bit and thinking, okay, it's not as straightforward as I first thought out. And yes, I was thinking about offering this to my clients, but what next? You know, hopefully some of what I've said has resonated with you in a pretty rubbish and negative way, but we're going to flip that on its head a little bit now. So salon whitening, can you honestly ascertain if somebody is dentally fit? Could you look at them and obviously work out, is there anything going on? Is there anything that anything I do to this client or give to this client is going to affect their dental arrangement, their periodontum and everything that's going on, their gums? Do I know this for sure? Can you deal with any complications that may occur and arise from this as well, from something that you're doing and or have done? And what about medical emergencies? So these are the three main pointers for me, really, that I would ask you to ask yourself with any procedure that you think about doing, not just tooth whitening, but if there's anything that you're thinking about offering in your clinic, are you completely set up in order to deal with the negative sides of things, like anything? Okay. Flip it onto its head. So here is the moment where I expose something that not many people know about. Actually, this happened to me at the beginning of the last lockdown. Okay, so this is my clinic. This is W Skin. One of the treatment rooms that I have there. Excuse the mess, it's tidier now. I'm a very messy worker and I used to leave stuff everywhere. Absolute nightmare. But this is one of my this is my main room. So I do my training in here. It's one-to-one training that I do, and this is where I treat my clients. Okay. I have 3 floors at my clinic, and I'm eventually moving up and having a dental suite in one of the floors at the back, so I can offer direct access cosmetic treatments and the things that I love to do. So that's on my business plan. So my website actually advertises me as a dental hygienist, dental therapist with my skin clinic, with my aesthetic clinic. And there is an ability to book in the likes of tooth whitening consultations and options with me, but not here, because this is not a registered building to do those procedures. Okay. So this building is primarily for my aesthetics and skin clinics that I have at the moment and the training that I do. But eventually it will be classed as a dental practice. It just isn't right now. I'm in the process of application. Okay. So this letter hit my door, as you can see, in April 20. No, it happened in March. The first letter came in March. So just as the lockdowns hit. So they wrote to us regarding a potential failure to comply with the Health and Social Care Act 2008. This was in respect of the regulated activities. So they thought I was doing surgical procedures and dental procedures and cosmetic procedures, and the treatment of disease, injury, or disorder. So I basically offering dental treatments in a non-dental setting. As a dental professional, I was like, oh, wow. Oh, they've got the complete wrong end of the stick here. No, I'm not offering them here. That is not something that I want to do yet until I'm obviously fully set up and everything is in place. And I really did get it wasn't easy to get rid of. It wasn't an easy thing for me to prove, because when I actually looked into it, my website had all this information on there about tooth whitening, but I wasn't doing it there. It was being done where I worked as an associate in a dental practice. It was a horrible, horrible time. And I am a dental professional that is qualified and regulated to do these sort of things. And I have since had, report of friends who have branched out and spent money on training and, whitening options that they were told they could do in any form of setting. And the letters that they have hit the door pretty much, within a small frame of time as well. Horrible, horrible moment. And this hit me. So, this is why I wanted to share it, because not many people know about this. It's quite embarrassing for me in my profession that this happened. However, it really highlighted to me that those of you that are out there buying these kits, being ripped off, kind of thinking that it is okay to do it, it really isn't. And you are potentially going to lose everything that you have, because again, it wasn't an easy thing to brush over. They wouldn't let me brush. I had to send pictures of my rooms. I had to go into a lot of detail with how, what, why I was advertising this, why this was there. And it was a horrible, horrible time anyway, because of the pandemic that we were going through. And then add that into it where I thought I was going to lose everything. Is it really worth it? That's what I would ask you this evening, to really, really think hard about. Is it really worth it? Okay. So why is it illegal? Let's work out why it is illegal. Hopefully we've kind of ticked a few of these boxes with the thoughts that we're thinking about in terms of, are they dentally fit? What else is going on behind the scenes? What about their medical history? I know I'm not saying that you don't take medical histories for the treatments that you do. I know that you do. But do you know enough around that aspect when we're treating the teeth and the gingiva as well, which is the gum? Okay. Why is it illegal? So these again are some images that a colleague shared with me this morning, and there are worse ones out there, but I just didn't want to kind of put anyone off their tea. But we are messing around with chemicals, and yes, some will claim to be harmless and natural and X, Y, and Z. But are they evidence-based? Or have they got papers and proof behind these things actually working and doing what they say they're going to do? Are we just completely stripping the tooth of all the moisture, which potentially some of them do? If you look at the ingredients of some of them, they contain something called phosphoric acid, which we use in the dental profession to actually etch a tooth before we stick something to it. It takes all the moisture out of that tooth. It's going to strip the tooth of all the moisture, and yeah, they are going to look lighter, but they're going to rehydrate quite quickly as well. Okay. Then we've got the issues that we can cause the gums and the gingiva. I've seen esophageal burns as well. So burns in the throat from these procedures as well. So as you can believe, as you can understand, this is something I feel so passionate about as a dental professional and somebody that works and integrates into the beauty industry. I really want to empower you to make the change and think, do you know what, actually, this is over to these guys. We're going to focus on this. And I want to show you this evening how we can help you and how we can make that work as well. So who cannot provide tooth whitening? The General Dental Council, who are they? That's the GDC that we call. So we are regulated by the GDC. They take the view that applying any materials and carrying out procedures designed to improve the appearance of teeth amounts to the practice of dentistry, regardless of what material it is, whether it's a prescription item or a non-POM item. It is the act of dentistry. This was recently confirmed by the High Court, where it overturned a magistrate's court's decision to acquit Miss Laura Jamos of the offences of practicing dentistry and lawfully carrying on the business of dentistry when not registered by the GDC. I mean, some of you might already know this, but Lorna was a beauty therapist and she was performing tooth whitening procedures in her beauty salon because she was trained and told that that's what she was able to do. She had the relevant insurance to do that as well, and she got found guilty of that as well. This decision confirmed that tooth whitening can only be carried out by the qualified and registered dentist, dental hygienist or dental therapist that is working to a prescription of a dentist as well. So that's who can provide tooth whitening. Tooth whitening products and kits brought over the counter on the internet can legally only contain up to 0.1% hydrogen peroxide. And there are an abundance of papers and information that will tell you that concentration of this amount is far too low to have any noticeable and long-term and proper effect on the colour of the teeth as well. Okay, this is another important point to note. This is a website I would direct anybody to that has any questions or qualms. A friend, it was actually a family member of mine's friend who has a brow salon, who was approached over the lockdown for some online tooth whitening training. She went for it. She parted with some hard-earned cash. She got a lamp. She got all the gear. And then she advertised it on Instagram. And obviously, as soon as I saw it, I didn't report it. I went to her and I said, look, do you realize that this is what's happened and you can't do this? And she began to give me the spiel that the company had told her. And it tends to be the same comments that are made, which we're going to go over in a moment as well. And she couldn't believe that this had happened. And it's happened today. I've had 3 or 4 messages from aesthetic practitioners and people with salons who have done this. They've invested that money, that money that they may have saved during lockdown to kind of reinvent and reopen their business. And it's heartbreaking. It's unbelievable that it's allowed to happen, to be honest. But I would direct you to this website, safetoothwhitening.org. And there's an FAQ section. I have took some snippets of it for you guys this evening so you can have a little look at it as well. Okay, so the FAQ section for beauticians and beauty therapists, so safetoothwhitening.org is where I will direct you. So one of the main comments that gets said is, look, I'm not using hydrogen peroxide. I get that is a prescription item. So it's not illegal, right? It can't be illegal because I'm not using hydrogen peroxide. It doesn't matter whether it's hydrogen peroxide or non-peroxide. It's still viewed and confirmed by the High Court that tooth whitening is the act of dentistry. Even if you're using below the legal limit of peroxide or a product that does not release any form of hydrogen peroxide, you're still breaking the law and you're still putting your clients at risk. Products used by dental professionals have been thoroughly tested for many years and have been proven to work throughout without being harmful to the teeth or the gums. So we know, and even if we have somebody who isn't dentally fit and they have other things going on, we wouldn't be doing tooth whitening on them in the first instance anyway. There's lots more that we need to do and put into place before we can offer them anything cosmetic like that. At best, other untested products that you may be using will not be effective, and at worst, they could, like those images, cause that permanent damage that we see as well. We may get holistic options and these natural options. I've even seen on Instagram that you can use a banana peel to whiten your teeth, but that is the dangers of the internet. What I would ask, and this is as an industry, as dental professionals, we are kind of forced to look for evidence behind things. And I'd recommend the same for you guys as well. If you're working with beauty and with skin products, if a company tells you this is going to happen from using this product, ask them how. Really understand the nature of how that's going to work. And it will change your mindset of how you do and what you spend your hard-earned money on in terms of the products as well. I know the guys at Shop Beautiful, they have, when you're ordering products from them, they've got options on there. You can read about the key ingredients and the products and why it's in there. And that's why I like working with these guys. This is another big one that comes back, and the client's going to apply it. This is on the documentary as well, so that's why it's worth the watch. I give everything to the client. They apply it. They do the trays. I'm just there to watch and or supply the product. Irrelevant. It's the active dentistry. It's falling under your umbrella. It's in your premises, or they've got the products from you. The book will stop at you. You are responsible, even with any sort of form and disclaimer that they are signing. The book will stop with you. It doesn't matter whether it's hydrogen peroxide or non-peroxide, as we've mentioned, it is the active dentistry, irrelevant of what any company is telling you. The reputable companies, the dental companies, the companies that will only provide with the products that actually work properly, will not provide you with those products because it's just not safe to do so when we're using them. So whitening businesses, training courses and starter kits. I'm seeing this even more at the moment. I'm seeing these startup whitening businesses on Facebook and Instagram, these quick invest things. It's breaking my heart because they offer the world. It's, as I say, it's a controversial subject. I get that. I am not everybody's best friend this evening, but I just feel passionate about the fact that you really don't want to be spending your hard-earned cash on this. And that's what this message is about. The only way you can be qualified to perform tooth whitening in the UK is if you're a qualified dental professional and registered with the General Dental Council, the GDC that I've mentioned. Many unscrupulous companies see the huge, relatively untapped tooth whitening market and begin selling these training courses and products to unsuspecting beauticians and other sort of therapists I've seen as well. For £1,000 to £2,000, anybody can train to be a tooth whitening technician and receive this certificate to show a day's course that's taught them, apparently, to recognise all the structures of the mouth, identify different filling materials, identify crowns, bridges or veneers, diagnose gum disease, and identify unsuitable clients. If that could be done in a day, then why would I have put myself through hell and back as a single parent at university for 3 years? That is my point to you guys this evening. And it's not a nice point to make, but this is one that I really feel passionately about. It really is that moment for you guys to kind of take a stand to these people and say, hang on a minute, I can't do this. The guys that have messaged me today that have brought these kits are going back and they are going to say, no, this isn't right. I can't do this. I can't do that. And that's the only way that we can get a change from this. It's the only way it can happen is by empowering you. We want to prevent this. We all want the best for our clients. That's why we're doing these webinars this evening. That is why we registered with all these different companies. We've looked into all this training over lockdown. We've discovered where we want to go with our business. We know what we want to do and how and who we want to help. There's going to be an all-time boom when we get back on the tour. People have been locked indoors and they've not been allowed to go anywhere. And then all of a sudden we're going to start going places and been doing things. And there is so much that you guys can offer, and this is just the point that I wanted to get across this evening as well, that we are practicing and doing things in a safe manner. I get it. I'm probably not your favorite person right now, and some of you probably aren't feeling the love, which is a feeling that I hate, because I love people coming onto my webinars and feeling positive and super vibed and ready to rock and take over the world at the end of the day. But let's just hang on for that little bit longer. Okay, you've got 25 more minutes left of me, and I want you to leave this being positive. Okay, so yes, have a sip of whatever it is, and what I've said is very, very serious and very important, and hopefully it's banked for you guys that maybe are thinking about doing this or you already do it. Okay, hopefully it's banked somewhere for you right now. Remember what I said right at the beginning? You rock, you do everything that you do. I have, I take my hat off to you. You have great passion in what you do. And I wanted to say that at the beginning. I'm going to say it again now because you do. That's why you're here. What I want you to start doing is thinking differently. Remember that second slide or third slide I said about thinking big? I want you to think, okay, right. Annette has said that this is a procedure that needs to be X, Y, and Z. I take that on board. How else can I do this? What can I do? Because I've got so many clients that are coming in and asking for this. Of course you are. And there's going to be more. There's going to be more and more of these individuals that are coming in that want these sort of procedures. Something else that we are seeing more and more of in the dental world is travel dentistry. So people are getting on a plane, they're going to Turkey or wherever it is, and they're coming back with a full mouth of veneers. Okay, I've seen 21-year-olds that have done this. The teeth are still erupting up to 26, 27 years old. There's been evidence in some places. So what's going to happen with these veneers is that they're going to be in a mess in a couple of years' time. Okay, it's not the same regulated industry that we have over here in the UK. And that's again something that if you've got clients that are coming to you and you've kind of educated yourself around these sort of subsidiary subjects, then you can really, really help them make the right decision for them as well. Okay. So work with us, not against us. We want to work with you. I know when I first started out in dentistry, I was looking to connect with like-minded beauty therapists, bridal shops, basically anything that kind of integrated us all together, because we want the same thing. We all want the same thing. We all want our clients to feel good, to look good, and be at their best. And the last thing we would want is a contraindication or something bad to happen that is down to us. So we all want the same thing. So I want you to reinvent how you think about this. Okay. Your clients are asking for these sort of procedures, no problem. You guys are in a unique position to upsell and work with us, not against us, work with us. You're going to build a rapport with some local dental practices. You know what? I can physically link you with local and friendly professionals if you want me to. Okay. I lean on these experts and we will lean on you too. If you offer these sort of treatments and you've got kind of skin treatments and options and you're an expert in your field, we want to know from you, and we can lean on yourselves as well. So it's that referral, that conversation. It's about networking with local businesses and other local relevant businesses that can have an impact on you and your clients as well. You network to negate new business options. So you're getting people asking for these procedures. You understand that. You hopefully now understand the dangers of doing these things in a non-regulated way. So how can you rectify that? How can you still offer these options? How about being a local beauty salon influencer for your dental practice? So reaching out to your dental practice, networking with them, talking to them, maybe trying the treatment for yourself, and then going out and selling that to all your clients potentially as well. Here's an option for you. Invest your hard-earned cash into skills that you can utilize. Don't line another business's pocket with products that you are never going to be able to use safely. And you're going to have to use behind, closed doors in an inappropriate way. Ultimately protect your clients from harm. You're working in this industry, you're working in the profession to make people feel good and look good and be their best. And the last thing you would want is to lose your livelihood and obviously suffer closure as well. As you saw that letter that I had, it happened to me. It could happen to anybody. These guys are on the lookout for it, and it's breaking my heart. Even in my inbox today, I've got this training tooth whitening option, and it's just unbelievable that it's still going on. So I want you to reinvent how you think about this. Again, if there's anybody anywhere in the UK that wants to connect with other like-minded individuals and dental professionals, I've got loads of contacts. I could line you up with these guys. Have the treatment yourself, build a rapport with these clinics, and be that influencer, be that business influencer, that networking influencer. That is my advice to you. I know I have been and I have looked for those salons, those individuals, those ones that think differently. And I know for a fact there are hundreds of dental professionals out there looking for you guys as well, with the connections and the networks that you have. So just bear that in mind. We're going to close. I'm coming to the end now with some top smile tips. So what can you be telling your clients? What can you be doing for your own teeth and your own smile? Most importantly, we're going to visit a dental professional regularly, because those things that happen that are horrible to the teeth are usually preventable. By coming to see us regularly, we can spot these things early and we can actually do something about it. So visit a dental professional regularly. Get your kids going at an early age so they recognize the smells and the sensors and whatever it is that is going on in there as well. The use of an electric toothbrush in the right way. Again, we'll show you how to do that. But an electric toothbrush oscillating or vibrating head, and we clean in between our teeth with interdental brushes or floss or both. Okay, really, really important. We avoid consistent use of abrasive whitening toothpaste. So there are lots of toothpaste out there. I literally stood in the aisle just the other day thinking, wow, how do my clients pick? And one thing I would advise is you can actually cause more harm than good by consistently using abrasive whitening toothpastes. You can cause slight abrasions to the teeth, which is then going to hold more stain, and you're going to end up with more stained teeth at the end of it. Okay. We keep snacking to a minimum. I'm a grazer. I'm on a bit of a health kick at the minute, but we choose neutralizing snacks. So things like cheeses that are going and milk-based, dairy-based products that are going to help neutralize these acids that we have in our mouth as well. We drink water between our meals. Here we go. With a meal, we're a little bit okay to have something that isn't water, but in between meals, we're having water. We don't rinse after we brush. We avoid smoking. We avoid too much tea, coffee, and obviously sugar, as we know as well. We choose professional whitening options like your in-chair or your take-home whitening as well. Okay. And again, if you want to connect with local dental practices, please do get in touch. I can help you with that, or do it for yourself and set that as part of your business plan for when you get back, if it is something that you have a lot of people asking for in terms of treatments. So what are the penalties for illegal tooth whitening? All offences that violate the Dentist Act are punishable by an unlimited fine and conditional discharge in England and Wales. These are heard in the Magistrates Court. To date, the largest fine handed out has been in excess of £15,000. In total, 100% of illegal tooth whitening cases brought to court have been given that guilty verdict. So again, is it really worth it? You rock at what you do, you're good at what you do, you offer lots and lots of treatments and options. But let's just remember what is our remit and when and where we need to lean on others. Because I know I do, if facials and things aren't my thing, I'm rubbish at certain things. And I have peers that work with me and colleagues that work with me who are absolutely smashing it. And that is what they do. So that's where we need to lean on each other and learn from one another as well. Okay. Work with us, not against us. And there's my dancing tooth again. I liked him. Up next week, a little bit more in my comfort zone, because I knew this week was a little bit controversial, but all too serious and it needed to get out there. We're going to be talking about the male skin considerations. So again, the male population, we are seeing more and more coming through the doors. They want these sort of treatments that are going to make them feel better and look better, or they've been pushed in by the wife and the partners. And we are there to help them with that as well. So we're going to be talking about follicular acne. We're going to be talking about various skin conditions, oily skin, and obviously shaving issues that can have on their skin, and the likes of aesthetic treatments for male skin considerations as well. So I look forward to welcoming you to that. Do have a look on the Shop Beautiful website, as I've mentioned. Look into the products, look around the products and the ingredients in them. There will be a blog to follow onto this as well, with the links to all those things that I've mentioned, for you to have a little look at in your own time as well. Those of you that are in this industry, have a look, if you haven't already, to the skin.org association. I'm an ambassador for Skin. They have an online accreditation for skin cancer and melanoma early detection, and we all play a pivotal role in that by looking at patients and clients' skin on a daily basis. So please do take a look at that as well for the hair and beauty industry. Do we have any questions this evening? Again, I want to close by thanking you for listening. I know it's not been my usual sort of webinar, but hopefully you've taken something away from it, and it's something that you can spread to colleagues of yours as well. Do we have any questions at this point? Let me have a little look. There's a few in the Q&A. Okay, so hello, Claire. Yep, you're a nurse from South Wales. Hopefully, Claire, you've got something from this evening. Do I offer teeth whitening in Manchester? Yes, I do, but not in my aesthetic and skin clinic. I do that via my dental practice under the prescription of a dentist. Sorry, it's not relevant to teeth whitening, but what's your favorite filler brand and why? Mantas, if you'd like to drop me a little message, I'm more than happy to talk to you about filler all night long. But if you have a little look on my website, you'll see the sort of brands that I work with as well. Claire, how do the companies who sell on Amazon, for example, get away with selling their products? It's a really good question, Claire. It's a difficult one. It's always going to be there. There are always going to be these pop-up companies that will pop up and do this. I'm not going to mention what or where, but it was quite a large organization that really shocked me the other week that actually had an exhibitor selling these items to these individuals as well. But again, you know, it's there, and awareness and education is key, and that's why I wanted to do this evening for you guys as well. So really, really important. So someone's asked, if you have a beauty clinic and want to provide whitening, is it mandatory to register with the CQC as a dental practice? Also, if a dentist is paid to do this inside a beauty clinic, is it okay? Right, that's a really good question. So if you have a beauty clinic and want to provide whitening, is it mandatory to register? Yes. If you are doing the active dentistry, you will need to register your premise with the local council as a dental practice. You will also need to go through all the formalities of registering your beauty salon as a dental practice with the CQC. If you're getting a dentist in or a dental therapist hygienist to work alongside a dentist to do these treatments, your beauty clinic will need to become a dental practice because it's the act of dentistry. So you would have to create a dental practice out of your clinic in order to offer these procedures. Okay. And that is no easy feat. That's what I'm doing now. My skin and aesthetic clinic is having a dental chair in it. And to go through the CQC registration is no easy feat. I mean, it's great if you want to do it. That's incredible. But you would need to have a GDC registered dental professional that is going to sit as a partner on your business as well. It's not as easy as you would think. Heather has said you can buy 3% hydrogen peroxide behind the counter to use as a rinse. It's different when we're using it as a rinse and in that form, Heather. In terms of tooth whitening, then the gels and the solutions, that's what's controlled by that EU regulation and the percentage of which we are allowed in order to do that way. And yes, you do have hydrogen peroxide mouthwashes, which are amazing for helping eliminate the likes of, bacterial problems and periodontal bacteria that can cause problems as well. Okay. So I'll just see if I've got any other questions that are coming through. So yeah, a little bit of a controversial one this evening, but hopefully I've answered all of those questions as well. I've had lots and lots of people reach out to me today that have spent money over lockdown on this training and these options that they've said that they've ticked all the boxes. You can get insurance, you can do this, you can do that. But I'm here telling you now that unfortunately it's not that easy, and it's not an easy subject to approach, especially if you've invested that money. But it's one that's very serious and true that we need to have a conversation about. But what I wanted to do is empower you to make that business decision and think, right, this is definitely something that my clients ask for. So I need to network and connect with my dental practice and move forward with this, because we'd love to hear from you. And again, if you feel a bit unsure about doing that, so then drop me a message. And I've got plenty of colleagues that will work that out with you as well. I know that they'd love to have somebody like you that is forward thinking and innovative on board with them as well. Okay, so yeah, thank you very much for joining me this evening. I hope you have, excuse me, a good rest of the evening. Oh dear. Enjoy your evening. Thank you very much for joining me, and take care, guys. Bye-bye.